Good morning, everybody. Thank you so much for joining us this morning for our final webinar of our research series. That's been a partnership between Nursing Now Challenge and the Royal College of Nursing. Our webinar this morning will be Leading Your Legacy. I'm Dr. Ada Hui, and I'm the UK Head of Research at the Royal College of Nursing, and I'm delighted to be joined by our panel of speakers today, Professor Stacy Johnson, as well as Professor Maurine Musie. So in terms of the session outline for today, this is going to be focused on writing a research proposal. So this is thinking about how you write a research proposal specifically around the prize for this webinar series, followed by presentations from Maureen as well as Stacy, and then opportunities for you to ask any questions to our panel members today as well. So in terms of writing a research proposal, when I first started this research webinar series, I spoke about research as being a thirst for knowledge and a hunger for change. So really encouraging to think about, what are you curious about? What is it that you want to change? And how might you go about doing this? And the research proposal is very much shining a spotlight on each of these questions. So it's your time to shine, to really showcase what you are curious about, what you want to change, and how you might go about embedding this. So a research proposal, broadly speaking, is around putting your plans into a written form to tell people what it is that you plan to do, what is it that you want to achieve, and how you're going to go about doing it. So in the broader sense, a research proposal is important for several reasons: communicating your thoughts and ideas, encouraging you to think about, how do you, if you're thinking about applying for funding for research, for example, or even speaking to your manager about it, how do you get that approval? How do you get that support with your research ideas? So for the purpose of the research proposal to become a potential prize winner, as part of this series, the research proposal will be thinking about what is your specific field or context of work, and focus on a specific area of your interest, whether that's around your own personal experiences, your workplace, your field of practice, an area of interest or population that you're specifically interested in working with. The research proposal will be a maximum of 1,000 words, and you'll need to submit this by the 29th of May to the email address below, that the challenge at nursingnow.global. And to be eligible for this, you will need to be either a student or early career nurse or midwife, and all of the details around eligibility will be found within the guidelines on the Nursing Now webpage. So I mentioned that there will be a prize associated with this. The prize winner for the best written research proposal will be funded to attend our Royal College of Nursing International Nursing Research Conference. And this will take place between the 15th and 17th of September in Glasgow in the UK. So please do save the date, and we'll very much look forward to seeing you there. So in terms of the structure for a research proposal, particularly in this context, we have outlined 5 specific areas for you to focus on and to write about. So the background, your research and aims, the design and methods, ethical considerations, and impact. So throughout our research webinar series, we've talked about each of those different areas. And so if you've missed any of those webinars, please do go back to them. They are all recorded and they're all available to re-listen to on the Nursing Now YouTube channel. So I'll go through each of these sections in a bit more detail over my next few slides. So in terms of the background should really offer a clear focus on what your topic is about. So what are you really focused on? What is your area of interest? So you might start off a little bit broader by talking about the more, general issues around this topic, but really try and focus, funnel, and condense this down into specifically what you are interested in. So what are the contemporary challenges? What are the contemporary issues? Why is this topic so important? And you might, within that, bring in your personal experiences. So what are your experiences of this topic that make it so interesting for you? What are these core issues and what are the key problems that you're going to focus on specifically? In terms of the research aims and objectives, so this is quite a um, short area to focus on. So just a few key statements outlining what is your research question. This might be a hypothesis, it might be an actual question, but thinking about what is your focus, and this might be through identifying current gaps in knowledge. Having clear statements about what are your aims and also what are your objectives. So what are you planning to do and how are you going to go about doing this? In terms of the designs and methods, so this goes into more detail about how you're going to do this. So what methods are you going to use in terms of whether this might be, a survey, interviews, questionnaires? How big is this going to be? How many people are you aiming to interview to include in this study, for example? So who are you going to involve and how? And this relates to your sample and population. So you might think about, who is it that's really important as part of this? Is this about patients, members of the public? Is it about nurses, other healthcare professionals, students? Who is it that you're going to involve and how are you going to reach them? Also thinking about the context. So where are you going to look at this? Is it around a specific area of nursing, for example? Is it in hospitals, community, public health? Is it within schools, higher education? Which area is that going to be? So being really detailed about this and having a really clear focus. And also thinking about after you've collected all of your findings, how are you going to analyze this? How are you going to analyze what you find? So in other words, it might be thinking about, if you're focusing on interviews, for example, are you going to focus on thematic analysis? So thinking about the current, the core trends, themes within that data. Are you going to use data software programs, for example? So if you're looking at quantitative analysis, are you going to use, for example, SPSS as your software? So thinking about, how is this going to be designed? What technology you might use? What support you might need, either from supervisors or, other academic or other charity organisations, partners, etc. So in our last webinar, we really focused around ethics. So thinking about what are the ethical considerations for your study, thinking about how we outweigh the benefits to the risks that might be involved, but also outlining how you might address any potential risks and thinking about how you might mitigate those, particularly if you're working, for example, with children or young people. Potentially vulnerable populations, so people, who might, have mental health problems, for example, or who might be at end of life, all of those different things that might need to be taken into consideration. Thinking also about capacity and consent. So ensuring that what what you're expecting from people, that people are truly informed before they give their consent to take part in your study. Thinking about, how we might use internet and social media to promote your study and to attract participants, for example. Thinking about how we keep our participants safe. So thinking about anonymity and confidentiality, especially if you're working with a really small population. So thinking about, how you protect people's identities. Also thinking about how you're going to store that data safely. So using password protection, for example, making sure that you store it securely. And also thinking about people's rights to withdraw from the study at any point. And if people do decide to withdraw, what you might also do with the data that you've already collected. And then finally, thinking about impact. So impact is around how you're going to share that information that you find. So whether you're going to write it up as a report, whether you're going to write it for publication, and that publication might be involved, might include different aspects. So it could be, for example, a blog. It could be an actual written peer-reviewed piece, writing for a journal, for example. But how are you going to get that information out there? And thinking about different audiences as well. So thinking about how people access that information. Is it written in a format that's accessible? And if you're writing for a journal, for example, thinking about, well, actually, some of those, especially academic journals, might be hidden behind paywalls. So thinking about how people have access to that information becomes really important. Also thinking about who you're going to influence and how. So is this around informing and influencing education, for example? Is it around developing new knowledge, new concepts, new ideas? Is it around influencing policy, wider aspects of health and social care legislation, for example? So who are your key people that you're going to contact? Who are those key networks? Who are those key partners that you need to make contact with and tell about these things? And what is it that you really want to change? So thinking about how to make this sustainable as well. So we talk about sustainability in a variety of ways. Sustainability in the sense of being green and environmentally friendly, but also sustainability in the sense of making sure that even after your study has been completed, thinking about how that change is sustainable over time. So that, in a nutshell, is what the research proposal that we're asking for, what we're asking you to do is about. I'm going to stop sharing my screen just so that I can see any questions that come about in the chat. So if you do have any questions, please do pop them into chats and I'll try and answer them as best I can. So bear with me while I just catch up on the chats. And it's great to see so many people from all over the world joining us this morning. Okay, so I can't see any questions in the chats for now. So I'll keep a lookout for any questions that might come a bit later. But for now, I'll hand over to Maureen for her presentation.
Okay. Just hope you all can see me. Please let me know if you can see my slides.
We can see your screen so far, Maureen, but we can't see your slides just yet.
Okay. Let me just check. Let me know if you can see. Are you able to see?
No, we can't see your slide.
Not yet. I hope you can see them now. Can you see my slides?
No, they did pop up a second ago, Maureen, but then they disappeared again.
Oh my God. Okay.
There they are. They're there.
Okay. Okay. Continue to share. Okay. Thank you so much. Good morning to you all. Aspiring undergraduate, honors, masters, PhD, post-PhD fellows who are aspiring to start their proposal. I would first like to appreciate Nursing Now Challenge Global Solution Initiative and Dr. Ada for having me today. I am Professor Maurine Musie. I'm a midwife specialist and also a midwifery lecturer from the University of Pretoria, and that's in South Africa. So I'll be sharing more with you on how to develop a strong research proposal. So this goes from, the extensive experience that I have in the area of research and from, the students that I have supervised, to completion your master's and PhD students. So what constitutes a good proposal? So I will be talking about this in 3 areas where a strong proposal begins with an understanding. So first of all, you need to know what you want to change. So I am reiterating what Dr. Ada has said, is that it's very important for you to know your why. Why are you doing this study that you want to do? So what do you want to change? And then the second thing is what you will need in order to make that change. And then the third step is how will you get there for you to be able to implement your study. So why does a research proposal matter? So it depends on your why. Are you addressing contemporary health challenges that you have noted in your setting? Let's say where you are, you can note what is it that is happening and that you think it can be solved through research, through, going through to generate evidence-based solutions. So in the field of nursing or midwifery, we can think about things like the implementation, of your emotive bundle in management of postpartum hemorrhage. So what is the contemporary health issues that you are trying to address? Are there any global health challenges or workforce challenges that you think they need to be solved? You also look at whatever that you're doing your study for. Is it to influence nursing practice? Is it to change practice, to improve the care that is currently being done at the health setting? Does it influence policy? Does it improve patient outcomes, so impact the community? So it's very important for you to know your why. Why are you doing this study? So that is very important. So as I indicated, I will look at structuring a good proposal based on these 3 steps. So what do you need to change? So this is where you need to identify your problem clearly. So I always tell my students that you don't start from a topic or a research question. You first start with what is the problem that you want to address? What is it that you have noted in practice? Let's say you are in the ward. What is it that you've noted that you really want to change? So you need to think about what is the problem clearly that you have identified. So very important then is that when you start with your proposal, you start by writing the problem statement. This is what I often advise my student. And for you to write your problem statement, you look at this 4 items. What is the reality, or what is the current gap? What is the ideal situation? How should things should be looking like? Let's say you're looking at workforce challenges. Maybe the challenge is that there's a migration, or nurses are moving to other, from the global south to the global north. So that is the reality. Ideally, what should be happening? So that's the next question that you ask yourself. And then you also look at the impact and the consequences. So what is the impact of this workforce challenge, for an example, in your context? Like if it is not resolved, what is it that can happen if this problem is not resolved? And then the last thing is the proposed solution. Then that is, if you've structured your problem statement answering these 4 things, then this makes it easier for the person that you're even pitching this to, like your supervisor or your mentor. Then this is how you would have clearly articulated your why. Why are you doing this study? Then you also look at what do you need for you to achieve this, or for you to address this problem. So you're sort of like building a foundation. So you look at literature review. So very important, you go through extensive literature review. You go and check out there globally what is happening, regarding this problem that I have identified. What is the literature saying about that? You also then have to write your research objectives, keep them smart, keep them specific, measurable, attainable, realistic, and within a specific time frame. Then you need to write your research questions, your research design and methods. How are you going to achieve addressing this problem that you've identified, and then your ethical considerations. So there needs to be a flow with, the title of your study, the problem statement, the literature, and the methods. All of this should, they should be consistency, or there should be a flow in what you are doing. Then a practical tool in terms of a literature review, you look at the latest evidence on the problem that you've identified. Summarize what are the key findings, the themes, the debates that you are finding in literature based on this problem that you want to resolve. Identify what is known and unknown about this problem. Position your study within the field of nursing and midwifery. So you look at how I always phrase to say is that they sort of like look at a tunnel to a funnel to start globally. What are they saying about my area of focus or the problem that I've identified, sub-Saharan Africa? Then also in my context, what is the literature saying? So it's very important for you to read. So what are some of the, things or some of the guidelines that you can go to? World Health Organization, your ICM, ICN, Royal College of Nursing, your State of World Nursing Report, FIGO. So you need to go through those different frameworks for you to be able to support what is it that you're saying, your national, your sustainable developmental goals. What are they saying, or what is it, which goal is your study aligned to? So very important. Then the last step is that how will you get there? So this is where you need to develop a research plan. You look at the research design. Is it quantitative, qualitative? Is it mixed methods? Data collection. How are you going to get to that problem that you've identified? Who are your participants, your sample? Analysis, what type of analysis? As Dr. Ada was saying, are you going to use softwares for your quantitative? Even qualitative these days, we use softwares like your Atlas TI. So you have to think about your analysis for you to come up with your themes, your sub-themes, and then the timeline, and also your ethical considerations. So these are the 3 steps that are very crucial for you to look at in order to develop a good proposal. Common mistakes to avoid is unclear problem. If your problem is not clear, or is too broad, it's not realistic, or it's not feasible, those are things that you need to avoid. Broad objectives that are not feasible. If there's a poor alignment, weak literature review, or inadequate methodology. So those are the things that you need to really avoid when you are working towards compiling a research proposal. And then tips that I have for you that can assist you to have a successful research proposal is that you need to start early. So you need to be passionate about this that you want to research. So it has to be something that you are concerned about and you want to go to, literature, you want to study further on this. So it has to be something that you are passionate about. Then I think that's when you can put in the work. Every week you read, you write. So it's very important to be consistent. You need to read extensively. Very, very important. What is out there? What are they saying regarding your problem? So that is very important to read. Seek mentorship, seek supervision. So along the steps, consult with your mentors, your supervisors for guidance. But you should have also read when you go to your supervisor. So that is very important to seek that supervision. Revise continuously. So put in effort on a daily basis. Go to your research proposal, put in the work. Then, you will mostly, complete or finish your proposal, within the reasonable time that is required. And then the last one, accept feedback positively. You get students, crying that, the feedback from the supervisor is all read, and the comments. But I think the supervisor, when they give you comments, it is to better your proposal. So accept that feedback positively and know that we are guiding you towards the right path. But we really want to see you succeeding in the research proposal or the research that you want to do. So these are the tips that I have for you. And then these are my references. And thank you so much. Good luck to you all in your journey of writing your research proposal. Thank you so much. Much appreciated.
Thank you so much, Maureen. That was great. And I'm sure so many different handy tips and advice for our listeners today as well. Just so for our listeners, as Stacey's preparing her presentation and sharing her slides, please do let us know in the chats, what are your ideas about what you're curious about? What is it that you really want to change? And so we can start those ideas and discussions going about how we might support you throughout this session, because it is I suppose it is a workshop today. So do let us know in the chats, and we'll have conversations as part of the questions and answers and discussions later on. Thank you so much again, Maureen and Stacey. I'd absolutely love to introduce Professor Stacey Johnson, who is our next speaker. To please share your slides, and do keep posting any questions that you have in the chats as we go along today as well. Thank you. Over to you, Stacey.
Great. Thank you so much, Ada. And again, really wonderful to hear some of those tips, Maureen. I need those tips. And perhaps that's one of the key learnings about being a researcher. This is an ongoing thing. We often talk about lifelong learning, but lifelong learning in research is really key. So I have lots of experience of doing research, but I've been scribbling away, both from Ada's presentation and some of the tips from Prof. Maureen as well. So you never stop learning, even when you are some of the most senior researchers. So, welcome to everyone. So lovely to see you. I've seen, please keep putting in the chat where you're joining us from. I've seen people joining from Taiwan, from Ethiopia, from Nigeria. It's really wonderful. I'm seeing people joining from Lebanon. Welcome, welcome, welcome. And so, start scribbling down your questions for Ada, for Maureen, and myself. We're gonna get you involved in the discussion afterwards. Okay, so both Ada and Maureen have talked to you very specifically about top tips for producing a really great, compelling research proposal. And I'm hoping that whatever stage you are in your research journey, that it's helpful. Whether, I think, Maureen, you pointed out, we could have really experienced researchers, pre-PhD, people hoping to do a PhD, undergraduates, clinical researchers, clinical practitioners who've never done research. So I'm hoping wherever you are in your research journey, the tips so far have been useful. And I want to broaden the conversation a little bit now. So I want to talk to you a little bit about why are we doing research proposals? What might be the bigger picture in terms of a research career, in terms of what you want to achieve in your practice? When you look back on your career in a few years' time, what will you want to have achieved, and what part will research have played in that? Okay, so I want to build on Ada and Maureen's work, and talk a bit about research legacy, so that in 2 weeks' time, or I forget the deadlines, when you are up late, when the kids are in bed, when you finished a really tough shift and you're trying to churn out that research proposal to try and win that competition to get to Glasgow in September, what is the thing that's going to keep you motivated? And a lot of that is about visioning your future. What do you want to do in the next few years of your career? And at the end of your career, what do you want to look back on and be able to say is your legacy? And so I want to talk to you today about research identity and the importance of identity in carving a research career, a research persona. I want to talk to you a little bit about the research itself and being innovative and intrepid in research and the research process. And it's interesting because I've got you've earlier heard from Dr. Ada Hui, and I don't know if Ada knows this, but often when I'm describing her to other people, I talk about her as an intrepid researcher, somebody who goes on to frontier topics, frontier areas. I don't know if it may be one of the earlier set webinars, she talked about her own research, where she went into medium security hospitals, mental health settings. I mean, I was like, this girl is quiet. How is she so brave, courageous to be doing research in those kinds of settings? So I'm going to talk a little bit about identity and how that feeds into the innovativeness of your research. Okay. And I'm going to talk to you a little bit about impact, beginning to look forward to that notion of what will your research legacy be. And we're hoping that this part of the conversation, so Ada and Maureen are about helping you with the technical tools you need to produce a really good research proposal. And what we're hoping is that this section gets you excited about doing research so that when you're doing the tough technical work of writing the research proposal, you are motivated, you keep going. So let's first think about identity. And again, keep thinking back to some of the things that Ada has said and some of the things that Maureen has said about purpose. Why are you doing it? Okay, so I'm going to spend the next few minutes talking to you about identity, innovation, and impact using myself and my work as a case study, almost a use case. Okay, so I'm going to talk about identity, and the first part of this graphic talks to you about what I began to notice. Notice, right? So that little kind of orangey newspaper clipping on the left of the screen that says mentee as mentor. I remember the moment where I was sitting in a hotel room in India. I don't know if there's anybody from India on the call in Hyderabad, and I was reading a newspaper. It was the Hyderabad Times, and you remember it was back in the days when it was an actual physical newspaper, a broadsheet. And I saw this article, Mentor as Mentee. And I was like, oh, what's that? That sounds interesting. What is that? And it was the first time I came across the term reverse mentoring as a concept. I'd been trying to solve lots of different problems before. Equality and diversity. How do we get leaders to emerge and unconventional leaders? And I noticed this idea, reverse mentoring. This is where a junior person, a student, a person less powerful, somebody with a disability, women, for example, they mentor someone in a more senior position than themselves, a very junior nurse, mentoring a very senior nursing director, a junior nurse, a junior physiotherapist mentoring the chief medical officer, the chief executive of the hospital. And this is one of my first things to say about being a really great researcher is notice things. I remember that was the 8th of October, 2010. It had a really big impact. That concept, that newspaper article had a really big impact on my research journey. I tore it out. The reason it's here on the screen as a photograph is because I tore it out and it's now raggedy. It's falling apart because I would keep pulling it out, touching it, fingering it. Notice the concepts that grab your attention. Notice the problems that you can't stop thinking about because maybe they are your problem to solve. So that was 2010. I first encountered the principle of reverse mentoring. So, and that, of course, was the beginning. If you look at the bottom of the graphic, the kind of blue arrow, this is where the notion of discovery in research starts off. I discovered an idea and I thought, Maureen talked about the importance of literature reviews. Okay, well, let me go and read about this more. Let me go and search what research is there out there about reverse mentoring. What is this phenomenon? Okay, that then drove me to do my own discovery research, which is generating new knowledge, which is the other type of discovery. Okay, so that first part of the process, which is about identity, what were the things that I was troubled by? What were the things that I noticed and that I felt excited about reverse mentoring to solve problems of people being marginalized, disempowered, nurses particularly, okay? And here I want to draw your attention to the most neglected ology. So some of you doing research methods and, Ada and Maureen, when they're teaching your research methods or when you're doing it in your universities and colleges, people talk a lot about ontology, epistemology, all of that. Not enough people talk about teleology. I don't know if there's anybody from Greece on the call. It comes from the Greek term telos. It is about purpose, end. What is it you're trying to achieve through your research? And I find this concept very important to us as healthcare workers because often our research problems are noticed and rooted in practice when you are giving care at the bedside. So obviously, so for me, it seems logical that the output, the research project, the findings from the research, you should be thinking about what is the purpose? What do I want? What impact do I want to have on the end user? And part of that, and understanding teleology, the purpose of your research, is also understanding your position, your identity as a researcher. Now, don't mistake me. When you start reading and writing some of your, particularly some of the quantitative methods that you're using for your research, a lot of the quantitative approaches will say, remove yourself from the research. Objectiveness, right? I'm talking about, I'm not yet talking about the methods. I'm talking about why are you choosing that topic? Why are you trying to solve that problem? What should you be noticing? Where should the research topics come from? Your practice, what you are noticing. So this is about your clinical interest. This is about you trying to solve a problem in practice. For some of you, it might be about community involvement. What kinds of things are you seeing that are problematic for your communities? I have a really great colleague, Dr. Hannah Dege, who is a pharmacist, but started noticing problems that women were having with fistula, for example. That's a community that she was not getting access to that as a pharmacist in a pharmacy. That was a community problem. And that has become a big area of her research. And of course, some of you may be activists trying to solve problems around climate change, climate justice, or other social issues and social problems. But also your identity as an insatiably curious person. This is one of the reasons why I think that nurses and clinicians, in case there's anybody on the call who is not a nurse, midwives are some of the best researchers because we are by nature curious. What is going on here? What am I missing? So keep hold of that. And the reason I really emphasize identity is because often, when I'm listening to Dr. Ada Hui, when I'm listening to Professor Maurine Musie, I'm intimidated. I'm thinking, how did they get there? They must be so amazing and knowledgeable. They are, but they started somewhere, right? So whoever you are on this call, wherever you're starting from, think about your clinical interest. What are you interested in clinically? Subject-wise, what do you believe in? If it's justice, the power of patients, maybe that's where your research topics are located. What do you want to change in the world? So it's important to be driven by the literature, but I would say if you're writing your research proposal, choosing a research topic, don't only be driven by a problem that somebody else is saying needs to be solved, right? So don't look. So I was working with a student recently who wanted to do something on AI. And I was like, and when I well, why do you want to do this? Oh, it's a hot topic. I was like, okay, but that's not necessarily going to sustain you, right? So don't be driven by what you think needs to be studied, okay? So tip number one in terms of identity, right? Don't think that you are too weird to do research. You capitalize on your weirdness, your distinctiveness, the problem that you are interested in, the problem that you want to believe in. Don't be driven by what other people are doing. Okay, that series of numbers on there. I know you all are from all over the world. I'm based in England. The significance of those three numbers, there are 24,000 professors in the United Kingdom. Only 100 of them look like me. Women of African descent. I grew up in the Caribbean, but I'm of African descent. My forefathers were trafficked to the Caribbean, right? So of people that look like me, people of Nigerian descent, people of Caribbean descent, etc. There are only 100 Black female professors. I'm number 83. 15, 20 years ago, I would be shrinking away. I'm the only nurse in this research team. I'm the only. Think of all the onlys that you have applied to yourself. I'm only a nurse. I've only got a BSc. I don't yet have a degree. I only have a master's. I don't have a PhD. Forget about all of that. We need you. We need the weird people, the unusual people. So capitalize on your weirdness in terms of identity. What are you interested in? Which communities are you a part of that trust you, that would not trust the professor because they don't know that professor? They're not part of the community. Identify your distinctiveness as a clinical practitioner, as a midwife, and think about how that can then translate into your research activity. How do you develop your profile? Okay. One of the questions that's really powerful, what are you known for in your little community, in your little hospital? And what do you want to be known for? Develop your identity as a researcher. Okay. You are a resource. Okay. So this notion of your identity. But look, Professor Maureen talked about the importance of mentorship. Who is the village? Remember, children are raised by villages, not by individuals, right? This is the same for researchers, okay? So who is your village? Who are the mentors? Seek out coaching, seek out sponsorship. And I don't mean cash sponsorship, I mean people who will seek out opportunities, give you opportunities, create opportunities, open up their networks to you, introduce you to people, bring you onto a research grant, bring you into a project. Seek out those people. Ask them, can I spend the morning with you? I'm trying to develop this idea. Is there any way I can come and spend a day with you, seeing what you do? Okay, so think about people as a resource. Be brave. Approach the most scary person in terms of your perceived distance. They're very, very senior. Often they want to share. They just haven't got the time necessarily always to go looking for people to share. So if you approach them, and you got to be brave because maybe sometimes people will tell you no. Okay. And of course, more broadly, organizations as a resource. Look at what a great example this is here. This collaboration between Nursing Now and the Royal College of Nursing Institute of Nursing Excellence. Organizations as a resource. So what scholarships, what sponsorship, but also can you get a secondment? Can you spend 6 months in an organization, for instance, if you are then seconded from your current employment? So think about yourself and other people as a resource. Okay. So that takes me into the next part of this graphic. Look, so remember, I had the idea, I've come across reverse mentoring, I'd started trying to research what it was and how we can do it. And I was very fortunate in that an organization was a good resource for me. So the NHS, the UK National Health Service, it was an NHS East Midlands. We're saying, okay, you know what? We're trying to support the career development of nurses who are not British born, right? And so as an organization, they provided resource for me to explore how could I use reverse mentoring to support some of those members of staff. 4 very pioneering, supportive NHS hospitals, 2 mental health hospitals and 2 kind of normal acute hospitals said, try it out on us. Experiment on us. So listen, organizations are as a result, but you have to tell them what you're doing. Okay. And they allowed me, we're now at, if you look along that middle line, we're now at 2016, 2017, where I began to experiment in these organizations with this idea that I developed through the discovery phase of my research. Okay. And again, you'll see in a second using different methods in the different phases of this research journey. Okay. Look at the very bottom. We're now back at the blue arrows, right? So you remember I started off with discovery. Then I started doing public engagement with industry, in this case, the National Health Service, hospitals. Okay. So you remember, research doesn't happen in a vacuum, you at your computer. It does involve people, inviting them. And Maureen talked about who wants to be part of your research, communities. What different methods will you use if you want to talk to research to senior leaders versus the methods you will have to use if you want to talk to women in rural areas, for example. So your research methodology is driven by who you want to be involved in the research. Okay. So look, I'm now at 2017. I'm testing, experimenting with the public to generate new knowledge in my research journey. Okay. So this takes us now to the second I, innovation in research inquiry, right? So part of what you're doing with your research proposals is setting up a plan for generating new knowledge, or if your research is applied, it might be about evaluating, understanding the effectiveness of an existing program, right? So you're not always generating brand new knowledge. And I guess one of the reasons I emphasize that is that some people are saying, yeah, but I don't think I'm going to produce anything really new. But fine, evaluation, where you actually are testing effectiveness of something that already exists, is still needed in applied research, clinical practice. Okay. In both cases, whether you're generating new knowledge or evaluating, curiosity is your superpower. So often people think I have to be technically able to do all types of research. I have to have done my PhD. I have to be a professor. Really, if you talk, I suspect if you spend time talking to Ada, Maurine, myself, think of anybody else who has run some of these seminars. I suspect that the common thread is we're nosy, curious. We can't let it go. There's a problem that plays over and over in our head, and we're always asking, I wonder how. I wonder why. I wonder who, right? Curiosity, right? That is your research superpower. Having said that, research doesn't run only on curiosity. You do need to learn your craft, read about different research methods, research approaches. Don't be put off by the theory. Embrace theory, all the technical knowledge, the underlying philosophy of research, the underlying philosophy of methods and methodology. Okay? So really refine and hone your technical research and inquiry expertise. Ask people, can I come and observe you while you're collecting data? Can I help you collect data? How can I get involved? Powerful question. How can I get involved? Okay. And hopefully in the discussion, we'll test that out. We'll say to Maureen, we'll say to Ada, when people say to you, whether it's a student, a PhD student, a junior member of clinical staff, when they say, can I come and spend the morning with you? Maybe we hear from them whether they think, no, that's just annoying, or whether they think, oh, how lovely. Please come, how welcoming they will be. And also learn and know your field. Now, one of the reasons that's really important is because often, and I don't know if maybe it's a nursing and midwifery thing, we often denigrate ourselves, we put ourselves down. But actually, often you, the person at the bedside, the person who was in practice this morning, knows the most about your field. It's not necessarily the researcher in the university, or the very senior doctor, or the very impressive professor. Often you, rooted in practice, are the person that knows your field. So think about how you can connect that then to research. Okay. So here we now are. I've developed a framework for delivering this reverse mentoring. So remember, I discovered the concept, I researched the concept, I spent time with organizations, with communities, trying to understand how do we do reverse mentoring. And I've now produced my output, TLOS, endpoint is I've produced a framework, a playbook for delivering reverse mentoring. So now we're 2017-18. And can you see the impact is increasing? We start off with just Stacy in a hotel room, 2 collaborating organizations, 4 pioneering NHS hospitals. Now I am using my framework in the real world. And between 2018 and 2020, yes, during COVID, I'd got up to, with just me, working with 26 organizations around the UK, implementing this reverse mentoring idea in NHS hospitals and universities. Okay, so you can see, yes, I'm publishing about reverse mentoring. Yes, I'm speaking at conferences, but I am not, the way I was really achieving purpose, telos, endpoint, who is benefiting in real life was through going into those organizations with this framework that I had developed using research with the community. Look, public engagement was beginning to have impact. Okay. The methodology I used is participatory action research. The methods I used included things like focus groups, things like interviews, right? Now, it made sense to co-produce this reverse mentoring framework with the community, right? So the participatory element of this methodology was about involving all these nurses from African backgrounds, Indian backgrounds, Asian backgrounds, who were experiencing problems in the UK NHS in helping me develop this framework. So you remember, this participatory action research is about bringing the community in. You're not doing the research by yourself, and you're not doing the research on them. They are co-researchers. So you can see what I'm saying about thinking about what problem you want to solve. Your identity, your beliefs influences your research methods. Okay? Action research worked for me because remember, I see myself identity-wise as a practitioner researcher. So I wanted it to be fast. I didn't want to wait 3 years for new knowledge to maybe be worked using in practice. I wanted that there to be evidence of action, right? Hence, for me, this problem, participatory action research, was the sensible research methodology. with then appropriate methods. Here, action research shouldn't look like you by yourself on a computer. Participatory action research. This is my research methods. I gathered people and I said, tell me, teach me, connect, right? Look, we were running workshops all over my part of England. That picture is significant because that's me a few years younger. Next to me was a student of mine. She was so instrumental in helping me organize the workshops, asking the questions. Yeah. So who is involved? Not just senior people. Wisdom doesn't only come from above, as in it's more senior people. That student, Hannah, helped me. We are unrecognized potential, they were saying. So I was like, okay, how do we bring that potential to the NHS, right? So action research, methods, I should know if you're doing quantitative methods. It should look different to action research. If you're doing I don't know, ethnography, that should look different. You should be embedded in the community. You should be spending the day on a ward in the uniform, right? So the methods and the methodology should be almost obvious from your methods. Okay, very active. So look, we're doing that testing and so on. Then of course we I don't know if you will see on the right hand side in that picture, you'll see Dr. Ada Hui. Because remember, I was refining using theory and then people. Here's the framework I produced. Is it right? What's wrong with it? It's active action research, right? But also, I'm not supposed to be refining that model by myself or from just theory where I started, right? It was people helping me using their expertise. Activeness. It's not tidy. Yes, sometimes you will use software, but sometimes you're going to have to get down on the ground and move the data around, okay? And again, look at that. I was with the community, but this chap on the left was a chief executive of the Mental Health Trust that said, come and experiment on us. So you also need to engage the leaders. Telos, purpose. You want them to implement your work, right? So think about how you can develop your bravery to be able to start talking to the policymakers. So my tip there about methodology, and I know that both Ada and everybody, Hannah, are going to be trying to say to me, hurry up, Stacy. So I'm nearly there, right? So the tip around innovation and research is roam at will methodologically. Until you develop focus and expertise, you need to spend time with Ada or people like her who are doing qualitative approaches. You need to spend time with the people who are doing quantitative research. You need to engage with the randomized control trials before you choose your approach and the approach that you want to develop your expertise in. Roam at will. The territory of research is no profession's explicit domain. Do not let doctors or pharmacists or statisticians or whatever hold you out of the research territory, right? It is ours to claim, nurses and midwives to claim, okay? So think about what methodology, what methods. Don't settle on a method or a methodology just because you didn't know any others, okay? And so then, of course, so what? Let's return to telos, purpose. Okay, so we talked about yourself and what you're interested in, identity. We've talked about the research itself. What about the so what? Now what? What impact does your research have in the real world? The endpoint researcher. So again, I know we're going beyond this notion of the proposal. And then, of course, you're going to do the research and you're just starting out, but already start thinking about how will you tell people so that they can use your research in practice, right? So do think about traditional publications, which are some of the journals that actively seek out novice, new researchers and want to support you to publish. And I know some of you on the call are much more experienced. So yes, do the traditional publications, but also think about the broader research communication. Use of social media to share messages from your research. This is a great opportunity for me to be reverse mentor because I just thought I'd cracked Twitter, then it became X, and then it kind of changed. So I'm not really as active on X anymore. In fact, my account has been hacked. I've now started using LinkedIn to talk maybe about more my research, because remember, many people who are not reading your academic nurse journals are on Twitter or X and on LinkedIn reading stuff. But this is where I guess the reverse mentoring comes in. I don't understand the TikToky. I can't use TikTok, but I mean, I can imagine what a powerful way it is to communicate research. I'm not using Instagram, right? But again, if that is where you live because you're doing other influencing, think about maybe that's where you can share and do communication about your research. Because remember, that is true knowledge exchange, not just other academics, other nurses, other midwives needing to know about your research, right? I mean, what a great initiative from nursing, the Nursing Now Challenge and the Royal College of Nursing to bring somebody to that conference in September. So attend conferences, little ones. If there aren't any conferences where you are, think about how you organize your own conference. Even if the first conference has 5 people in it, think about how you might do that. Look for opportunities to present, even if it's not a conference. Sit on panels, present to, small groups in your place of work. Think of places of practicing. You're talking about your research and your research interests. Consider how you might engage with policymakers, how you might advise. Okay. So here we're now up at about 2020, 21, where I was like, okay, I've done this in now 25 organizations. It's just me with some general support around advising and consultancy. How do I now do this at a bigger scale? And so the University of Nottingham, where I work, supported me to set up a separate company to do reverse mentoring across organizations, right? So suddenly, of course, the work now is reaching more people, but also policymakers, organizations, chief executives, etc. Okay. And can you see in that the first picture, me by myself in Hyderabad in that hotel room with a newspaper article? The picture on the very right, the kind of small blue picture, is me last year at OECD, Organization for Economic Cooperation and Development, at a panel talking about reverse mentoring, but also talking about its place in inclusion, supporting social advance, and so on, right? So, and we were doing reverse mentoring with OECD. So, from one person in a hotel room to working with an organization, you remember OECD has 38 member states, and then more broadly, other members who are associated. And we were doing it at their headquarters in Paris with leaders from a range of countries who are member states, Mexican leaders, Norwegian leaders, and of course, and with more junior staff from all kinds of different countries, disabled junior staff, racially minoritized, ethnic minority junior staff, disabled, all kinds, LGBT, lesbian, gay, trans, all kinds of young junior workers who are saying, I want to share. I want to mentor these leaders. So look, here we then have the potential for impact across many nations as these leaders are influenced by reverse mentoring, right? So here is the thing. When you are writing your research proposal and you're thinking about what do I want the next few years of my career to go like, I want you to just remind yourself from the one newspaper article, Stacy Johnson by herself in India, to Stacy Johnson working with her community. I couldn't have done it without the community. Look at the middle of that action research process. In none of those pictures was I by myself defining and developing the framework, doing the research, action, participatory action research, right? All the way to now working with more than 90 organizations across the world, United States. Um, uh, we're doing a big retail organization, Marks and Spencer's, for instance, right? Think about the impact your research could have so that when you're looking back on your legacy, it is what you want it to be. This part of the telos, the teleology, the purpose of your work. Okay. So again, think really broadly. Think about if you're doing research and you now have knowledge, how can you do consultancy? How can you advise? How can you train others? How do you protect? This is something that maybe nurses don't necessarily think about in the way that perhaps engineers and other professions think about. When you're creating new knowledge through research, if that knowledge is unique, then we call that intellectual property. It's an actual asset. Unlike engineers, where it might be a phone or a widget, sometimes our intellectual property is ideas, distinctive, unique ideas. think about and start reading about how you protect those ideas. Because remember, some of those ideas, you remember I started a business doing reverse mentoring. I still work for the University of Nottingham, but they helped me to start a business, which we charge money for. That's me commercializing my intellectual property, my ideas. Okay. And what that means is I can use that money to drive inclusion, to improve how leaders see junior people. I can use that money to raise the profile of my research. Okay. I am now, as a result, having to learn how to be a business owner, lifelong learning. But again, I am now not just talking about reverse mentoring and nursing, I'm talking about being a woman doing a business. So again, a chance to influence in a different way. Because again, I don't see very many women, Caribbean business owners in the United Kingdom, right? So here, the broadening of the influence. I'm understanding myself now as an employer because I now have a team of 5. And again, thinking about how you might influence policymakers. So, for example, during COVID, I wasn't. It was quite tricky because, of course, I had the chance to do this parliamentary fellowship, but of course, it all kicked off during COVID. Wasn't able to actually do the work, but there was the chance. I noticed that there were these parliamentary fellowships where you could apply to do your research in the UK Parliament. What are the similar opportunities for you? In Lebanon, in Taiwan, in Nigeria, wherever your regional areas, right? They're asking for ideas all the time. Okay. Think about how you can get involved in observing ethics, ethics committees, grant and scholarship committees, and so on. And think about how maybe there are journals in your areas. You develop clinical expertise. We're always looking for people to review journal articles in specific topic areas. That might be some of the ways that you influence. Okay, and so that's the whole story. Along the top, those purple balls are about increasing reach and impact. Along the middle was the process, me by myself, then me with this participatory action research community who helped me develop my theoretical ideas into a research idea, discovery of new knowledge, the creation of this reverse mentoring framework, and then working with organizations and policymakers, and over now to this point where we are influencing. The bottom part of that diagram talks about that journey as a research and knowledge exchange journey. Notice I don't just say research, but also the knowledge exchange. How do you get that research into practice? And you can see me going there from discovery by myself to public engagement to industry, whatever your industry is, whether it is the hospital sector, whether you're working in the private sector, whether you're doing drug trials, whatever the industry is. Knowledge generation and invention as a research activity. Yes, for you, not just for the engineers. You can be generating new knowledge. And yes, you can be commercializing that knowledge. It's not just for the other professions, the doctors, the engineers, right? We nurses, midwives can commercialize our research knowledge. I don't just mean commercialize your labor, going and doing a shift. I mean, commercializing your knowledge and expertise. So seek out opportunities where you see workshops about commercializing expertise, doing consultancy, running a training business. Often we're ignoring those. We're going to only the clinical workshops, right? Start going, seeking out that knowledge. And finally, the benefit is social impact. So I go on and on about commercialization, but it's not about being wealthy. It's about the thing that has really stuck with me is that I believe that if I were just publishing in journals about my reverse mentoring journey and my reverse mentoring research, I'm not convinced that I would be confident that 90 or more organizations around the world were using my reverse mentoring framework. Right? So think about the social impact that you want to create. Because remember, it's not just about those organizations using it, but all of the people who work in those organizations benefiting because their leaders are more inclusive. Their leaders are listening better to more junior staff. Okay. So the tip here around impact, who needs to know about your research? And that should influence where you are communicating your research. Is it just at conferences, or is it which kind of conferences then? Is it just publications, or is it also social media? A short summary about your research on social media. Who needs to know? Who needs to use your research? And therefore, where will you communicate your research? You are the right people. You are the right person to do research to influence practice through research and to be sharing that message. I know it doesn't matter how junior you are, it doesn't matter what your gender is, what part of the country, what tribe you are in Nigeria, you are the right person. And so my last words before we then open it up for questions. I know you're wondering about that first one. I wish for you failure. Now, I don't want you to be a failure, but I wish for you over the course of your career, episodes of failure, because remember, if you are not failing, often it's because you're not trying. You're not experimenting. Start small, just do it, right? Do not be afraid of failure. Because honestly, you remember, for every one successful, loud person you're seeing on social media, they have experienced 7 or 8 failures. Every successful project, I mean, again, it may be in the discussion, Ada and Maureen will talk about this. Of the 10 research publications, how many failed? If you are not trying and failing, you are not going to have any successes to talk about. So I wish for you much failure, because if you have many experiments and failures, it means you will have more successes. I wish for you failure. You remember I said roam at will. Do not be held out of the research territory or any territory by anyone else. You assume that you are welcome in that space. Proceed as if welcome. Then let them kick you out, but don't stay outside of the room because you think you might not be welcome. Proceed as if welcome in where people are doing research, even in methods and methodologies that you're not familiar with, even if you've never done research before. Talk to sometimes the conversations we're having with our PhD supervisors are very limited, narrow. I can only talk about the technical work. But no, ask them about their career. Proceed as if welcome. Can we spend half an hour talking about some of your career journeys? Can we talk about some of your biggest failures? Proceed as if welcome. And I can't tell you don't be afraid. But do not be afraid of being afraid. Do not fear fear. Instead, let fear catalyze your courage. Now, it doesn't start with courage. I didn't wake up this morning thinking, today I will be courageous. First, the fear comes. I'm fearful of doing a terrible talk. I'm fearful that this research project will not be accepted. The proposal is not going to be perfect. Right? But if if you are immobilized by fear, this is the problem. Instead, let the fear then be the stimulant for you to look for the courage to act, whatever you need that courage for. To ask your manager, I'm writing this proposal. Will you critique it for me before I submit it? I have an idea for a research project, or I've only been doing quantitative research. I know that you are one of the leading qualitative researchers in Ibadan, in Oyo State, or in Tripoli, or where else are people joining us from? I can't remember. Right? I hear you're the leading. I have some money for this. Can I come and spend a week watching what you do? Right? You will be nervous to ask. You will get no's. You will get knockbacks, but do not let that fear immobilize you. So do not fear fear. Instead, let fear catalyze your courage. Thank you so much. I know I went over time, Anna and Ada, but hopefully we still have time for some discussion.
We absolutely do. Thank you so much, Stacey, for all of your wisdom and insights, talking through, your experiences and expertise within that space. And I had absolutely no idea that you had been thinking of me as being intrepid, because the idea of that
So
for me is
brave.
absolutely terrifying. So it's absolutely fascinating, how we see ourselves, how other people see us, but also thinking about us individually as each being experts with different insights, different perspectives, and different knowledge and different skills to offer within this wider research space as well. So thank you so much, Stacey. I'd like to bring Professor Maureen back into the call as well. We do have a couple of questions. So if you could both please keep your cameras and mics turned on, and we'll go through some of the questions and discussions to follow. So Stacey, if you'd like to turn your camera and mic back on. And we've got a couple of questions in the chat. So we have the first one from Yopi. I'm interested in communicating research findings or even the research process itself to policymakers specifically. Do you have any tips on how to get started with this, especially for policymakers who may not be familiar with research that involves policymakers?
Yeah. Absolutely.
Okay.
And I'm wondering whether that person maybe wants to unmute their mic and come on because, it does vary by country, it varies by area. What are the structures there? I would say start reading, go on the websites, go on the Ministry of Health website, or even maybe start local, right? So start in your region, even if you still don't go to your Ministry of Health, your national level, right? What are some of the smaller administrative units? Whether is it okay if you're working in a hospital setting, who is the director of the thing that you're interested in, or who at regional level in your state, your city might be interested, right? Start practicing with that. Reach out, but also notice there's so many things I think, oh, what I've been doing with my life, right? Because there's so many emails that will come through, like that parliamentary fellowship. I'd never looked at those things before. I was just chasing grant funding or thinking about what should be publishing. I had never paid attention to things like that. So first of all, start reading your email better, right? Set yourself up. Go and look at some of the organizations. Again, I don't know. Hopefully that person comes on in a second and tells us where they are. But really odd organizations that you don't necessarily think are linked to nursing. So the Commonwealth Secretariat, the Commonwealth Fund, has really interesting opportunities to consult. World Health Organization, lots of weird obviously, okay, World Health Organization is a really obvious one, right? But there are lots of weird organizations that I didn't think were interested in healthcare stuff, like Commonwealth Fund. I didn't know until I started working with the OECD that yes, they write and they collaborate a lot around economic stuff, but linked to health. And I was like, oh, I could have been doing work with OECD around health all the time. But again, even at local level, in your hospital, in your university, who is the next level up, that might be interested in your research? And then build your confidence so that you're then looking at regional level, you're then looking at what's happening at major government level. Is the person who's asked that question able to unmute and just maybe tell me a little bit more about where you're based? And I don't know if Ada and Maureen have any advice as well.
Yeah, I'm not sure that the participant's
Yes.
able to unmute.
Right. Okay.
Yeah,
Yeah.
but if you'd like to type
Okay.
more into the chats for context, then I will read that out.
Yeah.
Maureen, do you have anything to add? I've got a few ideas, but I'd like to go to you first.
Yes, can I come in on that? What I can say is that policymakers don't read articles, don't have time to read our
Hmm.
full
Yep.
paper that we've written about a certain idea. So they don't, so that is not their type of what? So they don't engage more with articles that we write. So you have to think about different ways in which you can disseminate your findings. But before that, I would want to think that involve them within your research process. So if you have an objective that maybe seeks stakeholders involvement, so involve them within your study as you are still working on it, to gain their perspective um, at the point where your study is still in development, rather than doing the study, you're finishing, and then you come back and say, by the way, this is what we have recommendations, for policy can be involved in this. I think they need to be involved from the word go, in terms of your research study. Let them be involved within your research process and align to national imperatives. So if there's, align to what is currently, things that they are focusing on in terms of policy. And as Prof. Stacy has indicated, your dissemination also matters. So as I've indicated, you can think about writing a policy brief. You can think about sharing your results on LinkedIn, TikTok, from whatever space. Think about having a webinar on that, your results, or sharing, or think about stakeholder roundtables. So your dissemination has to be different. It's not all have to be written in scientific papers, but the way that you present it to them, so that they are able to understand what is it that it is contributing in terms of policy, or what needs to change. So they need to be part of the change, or part of the research process, if I can just summarize in a nutshell. Thank you.
Thank you. And I'd add to that, we talked a few sessions ago around expert advisory panels, either us as nurses getting involved in expert advisory panels to be the expert with our specialist expertise, but also inviting policymakers, wider stakeholders to be involved in those as well. And having worked in the policy space myself, so my PhD was in sociology and social policy, I'd say start with high quality research because the policies can only be as good as the research is if we're informing policies through our research. So the importance of inclusive design, making sure that underrepresented populations are included, underrepresented voices are included in the research so that can really shape change in practice. And prepare for the unexpected as well. I think that is one of the crucial parts of research, not only in terms of the unexpected, as in, research is very rarely a linear process that's neat and tidy as we see in written, published papers, for example. It's often messy. But that messiness teaches us, as Stacey said, we learn from those things, but also preparing for the unexpected, as in, I talked about my research journey as different crucial stages. It's not a linear process, but all of those small steps lead to those big changes. For example, lobbying for legislative changes for the Mental Health Act in the UK was something I was completely not expecting to be able to do through my research. Working with the World Health Organization and shaping global policy, they do not happen overnight. But we can make those smaller changes that lead to these larger scale changes over time. So the second question is from Samuel. So Samuel says, AI is increasingly becoming part of healthcare education, leadership, and even early stage research development. How can nurses and nurse researchers use AI intelligently and ethically, particularly in areas like literature exploration, proposal development, reflective practice, and innovation, while still maintaining academic integrity, critical thinking, human judgment, and compassion at the centre of nursing? So I realise AI is, a huge and massively topical area right now, and there's so much to think about within that space. Any thoughts, Stacey and Maureen?
If I start at the end, so one of the things that occurred to me when Maureen was talking about policymakers not reading research. And to be fair, not even researchers read people's research properly anyway, right? But yes, I think, and I have read that question. I know that your question is about things like in the literature review process and so on, and we can come back to that. But it occurred to me that one of the ways that you can use AI really quite effectively is to help you go from, I'm not saying upload your 3,000, your 20-page research paper and say, please produce a policy brief. But it certainly can help you write better policy briefs, right? Or, how we're saying, how do you convey that on TikTok? So one of the things I find that AI can do quite well is produce graphics and infographics in a way that it would take me 3 days to do, right? So for me, let's start at the end point, which is rather than it synthesizing for you, let's work out how it can do things with the products of your work, right? That might be better, right? Which is to turn this into a policy brief. And it's a starting point, right? You do not put that out like that. You've got to still go through it, right? Or produce an infographic or a short animation or video that can convey this and tell it which community you wanted to convey it to, right? So I'm just wondering whether, rather than thinking about how it does some of the more the more complex stuff, one thing I think it might maybe can help us with is the stuff around making the products more accessible. Give me a suggestion for a script for a 10-second TikTok, whatever you call a TikTok post, about fistula or whatever, right? Whatever we're doing with AI, two key messages. One is it will not replace humanness. So, you're talking about OECD, World Economic Forum, and we were talking about this at OECD when I was in Paris a couple of weeks ago. They've produced this kind of diagram. It's a matrix like that. It's skills that will be reducing in relevance and skills that are increasing in relevance, and the skills, therefore, that are needed by 2030. And in the top right quadrant of that thing, in the face of advances in AI, the skills that will still be needed by 2020, by 2030 and beyond are empathy, resilience, analytical thinking, right? The notion of wisdom remains important. And by wisdom, I mean knowledge, because I think the problem is that we believe that AI knows more than us. Yes, knowledge is important, and we need to still be learning and creating knowledge. But wisdom is also about lived experience. And by that, I mean lived experience of marginalizing things like being disabled or having mental health issues, or our own lived experience, but also our lived experience of doing the work, doing research, doing, problems that you encounter, which is what you learn from, right? So your lived experience is important. But also, here is the thing. One of the elements of wisdom, one of these human components that AI cannot replace, is discernment, analytical thinking, critical thinking, spotting when AI hallucinates, spotting when AI is not being critical, spotting when AI has missed something, spotting when AI is trying to maintain dependence, right? So remember, we've seen suicides in the UK where AI has been actively supporting the person to not disclose that they're struggling. You don't need to tell anybody else, right? One of the reasons that we know people are saying, oh, AI is going to replace coaching. But when they analyze the conversations between AI coaches and their coachees, unlike therapists and coaches whose aim, telos, is to make people independent of them, they found that the AI coaches actively sought to keep people dependent on them, right? So that discernment, and also discernment between truth and deception. So remember, we're not in a post-truth society anymore. We're in a post-truth society, right? And so the ability to spot when AI is giving us accidental deception, so hallucinations, but also garbage in. So when we are feeding it rubbish data, it's going to give us rubbish outcomes. So our ability to discern between truth, well presented work, research supported outputs, and deception is going to be really important, right? So for me, it's not so much about what AI, all the different agents, all the different platforms, whether it's agentic AI or generative AI, it's not so much about what they can do, but what we will do with that information that they produce, right? Because we need to retain our expertise in discernment, because otherwise we are going to just have lots of rubbish produced and used and brought to policymakers, right? And so the last area of discernment, again, which I was reading around with AI, is the discernment between right and wrong, right? Not just morals and ethics, but right and wrong, right? Because remember, it's not necessarily that AI doesn't know what's right or wrong, but a lot of the underlying code is about maintaining commercial dependence. It's about, you got to keep buying my platform as the AI. So some of the examples we've seen in some of the ethics scenarios is where the AI is sending out outputs that is about protecting itself, right? So that notion of discernment remains important. So whether it is literature databases, whether it's access to, AI doing clinical decision making, etc. For me, the underlying expertise that we as healthcare workers have to really double down on is our ability to discern and make sure that we have safeguards in place, however we're using them, to make sure that there is that specific human element, not just the human element that we read the stuff, but what are you reading the stuff that it produces for? Yeah.
Thank you so much, Stacey. And one quick final question is from Beth in Nairobi, who asks, for those of us with no access to literature databases, are there databases we can access at zero cost in order to start with research, such as literature reviews? Also, accessible journals that are not prohibitively expensive, open to hearing views and suggestions. And thank you for this session. So, Beth, for me, starting with something like Google Scholar, there's so many free to access journals on there where you don't require to be registered to a database, because I realise these are really expensive. And after you've looked on something like Google Scholar as a starting point, then reaching out to those authors if you don't have access. And that often, for me, authors are often generous in providing those articles, emailing you a PDF copy of those. And often it also sparks that opportunity to have conversations with them as well about those research spaces. So I think that would be my top tip and advice. Maureen and Stacey, any further suggestions there?
I think in our case, if you are unable to access an article, you can ask the librarian from the university where you are enrolled in. So that's if you are, doing your proposal for a degree or something. So there are librarians that can give you access to that article that you need you need to review. But as Dr. Ada has indicated, you can also write to those authors. But Google Scholar definitely is a good place. But I also know EBSCOhost includes a lot of research databases into one database, like your CINAHL, your PubMed, they are all within the EBSCOhost. So I really think there is a way that you can be able to access the files if you're looking for it. So try out very various ways, but definitely you can go through those various channels. Yeah.
Brilliant. Thank you so much. I realise that we are very, very close to time now. So I'd like to say a huge, huge thank you again to Professor Stacey Johnson, Professor Maurine Musie, and also to Hannah Finch, who's been working
Thank you,
tirelessly
Hannah.
around with me, across this whole research webinar series. I'm delighted that there's been so many people joining this webinar series. And it's been, an absolute pleasure to host and lead on the series as well. So thank you everyone so very much, both for today as well as across the whole series. Please do connect with us either on LinkedIn or send us an email if you have any further questions or anything that we can support with, anything around research or what we've been spoken about today. Do listen back on the recordings, and we'll very much look forward to receiving your research proposals and to hopefully meeting you at the RCN International Research Conference. So huge thank you again, and we look forward to seeing you soon.
Yeah.
Thank you so much,
Thank
everybody.
you.
Bye,
Bye,
everybody.
everybody.
Thank
Bye.
you.